So we know that mistakes happen in healthcare. I mean, there's plenty of literature out there, but the goal is when people make mistakes, there should be enough processes in place to keep that mistake from reaching the actual patient.
When I think of culture of safety, I think of kind of paradigmatically, it's a reporting culture, it's a learning culture, and that all of that is undergirded by it's a just culture, and all three of those things have to work.
Prior to Scott's arrival, we really didn't have anything formalized in regards to focus on safety. First off, you know, we have a daily safety huddle every morning. With that ongoing implementation, it was emphasized that safety was our top priority, which I think obviously sets the tone for the whole organization.
When near misses occur, when precursor events occur, when things that are unexpected occur, we need to report those. And then when those are reported, we need to study that, we need to learn from that. But none of that works if the culture isn't such that folks feel safe reporting mistakes and bringing those things forward, and have confidence that in bringing those things forward, the focus will be not on the individual, but on process improvement.
When he implemented administrative safety rounds, I think that's really when our culture of safety changed in our organization. He literally requires that we block out 30 minutes on our calendar each week, and all of the executive team goes upstairs. We take different departments, and we literally ask the care team members, do they have any safety concerns? They can be patient, visitor, or care team member safety concerns.
What I find is that he is a great partner. So I think what makes him a great leader for me is that he listens to what we need. He is very data driven, and that works for me as a statistician. You know, I can provide him that information, and we can have good, hearty conversations about, you know, what's the right thing to do for the patient. And I think if you can lay your head on the pillow at the end of every day and say, I've done the right thing for all of your patients, then you have nothing else to worry about, because it's the right thing, right? I think that is the flavor that he brings to everything that he touches within this facility.
So one of the things that I said early on when I came here is, okay, here's our run rate on incident reports. And it sounds a little counterintuitive, but you know, I said I want to see those go up. And not because I want us to have more incidents, but I know that we're having them, so we have to be reporting them. Every time we have an incident that's reported, and oftentimes these incidents are near misses, they're precursor events, or things that don't make it to a patient, but they're things that we can learn from to improve processes, right? So, you know, I said we want to see those things increase, because every one of those is an opportunity for us to learn and to make our processes better. And then from there, we move towards zero harm, and we move towards hopefully high reliability.
There's no retaliation, so if you make a mistake, there's an opportunity to correct your mistakes. And I think that's a #1 factor as well. People feel much more comfortable bringing things up that may be wrong, making sure that you're doing the right thing. And if you make a mistake, there's human error, and we all have it. And so you admit that you've made a mistake, and you don't get penalized for that. You know, you learn from that, and there are opportunities to do better. And so that's the main thing I think that Scott has shown us.
There's nothing in this for personal gain. This is all about how can we provide the best health care to our community, and how can he contribute to that success.
I recognized early on that Scott was not the average CEO. He had a unique perspective, and it was definitely because of his background with his child.
Luke was born in a southern province of China, Guangdong province, and has spina bifida. He was adopted from China when he was about 5 years old. So not long after me coming here, he needed a relatively significant procedure. And one of the things that I observed was how good the nurses at Sean Jenkins were at doing what I would call bedside shift reports. So there's something called a patient safety bundle, and that impacts experience, and it also impacts quality. And so I have used that example of that evidence-based practice, the patient safety bundle, specifically bedside shift report, and the difference that made for us in being able to do post-op care for him on a number of occasions. And I think sometimes when people see it in that light, it helps folks understand, oh, well, this is not just another thing. This is important for the experience of this patient, but this is important for the quality of care of this patient.
He wants the very best for every single person, whether you're a patient in the hospital, whether you're a visitor, whether for all care team members, that is his #1 priority. And he says that in every single day that we have our daily safety huddles. Everything that he does, he breathes, eats, sleeps it. He's amazing.